Thanks for staying with us here on News Radio 1080 KRLD. Welcome to Ask the Expert, North Texas. I'm David Rankin.
And I'm Kristen Diaz, and we are joined by Christina Mintner. She is the Vice President of Population Health and Homes with Parkland Hospital. And Christina, we've been hearing about Parkland Hospital wanting to consolidate its youth and family clinics. And that means that some of the clinics are going to be closing. So for our listeners, we wanted to explain what exactly is the plan and of being able to serve more Dallas families.
Sure. So what we did was we looked at the access to care that we were currently providing within DISD, and we realized that we really weren't providing the full access that a child needs. So children and adolescents need healthcare. They get sick every day. And so we had clinics that were only open 1 to 3 days per week, and that really wasn't meeting the needs of the community.
Why were these clinics only open 1 to 2 days a week?
So when we originally started them, it was to put them in as many places as we could so that we could see as many students across that DISD. But in the end, we found out that based on feedback from our patients and the families, that they really needed more regular care for their children.
So just not as efficient as you were hoping it to be by moving to all these different locations. So now how is the consolidation how is that going to work?
So we have 11, currently we have 11 youth and family clinics, and we're consolidating them down to 4 in DISD. And these 4 clinics will be open 5 days a week. And so what we looked at was which clinics were closer to other areas where we have a Parkland facility. So the children that live near the clinics that are going to be closed will be transferred to one of our other sites. So we're making sure that no child is left behind.
And some of these clinics, are they further away for some families, and will it make it a little more difficult for them to get to those new clinics?
Well, again, that's what we made sure. We made sure that any of the clinics that we were closing, that there was a Parkland clinic within their community as well. So nobody will be left without care.
With kids, they could have all sorts of ailments. What kind of doctors will be at these facilities? Is it just general practitioners, or will there be any specialties?
We have general practitioners and pediatricians, and so we provide all the care that a child will need for their primary healthcare needs.
What kinds of things do you see kids needing, especially in a hot summer?
Well, we have a lot of asthma. So asthma is one of our top diagnoses in our children and adolescents. And every child and adolescent needs a well child exam. So this is an exam that's done multiple times a year or once a year when they become an adolescent, and it looks at all areas of the child's like emotional, mental, and physical well-being. Obviously, when school starts, we have a lot of kids that just end up getting sick, just the normal strep throat, cough, and of course, we do a lot of vaccines as well.
And are these also bilingual sites? A lot of Hispanics also live and have kids within DISD.
We do have staff that are bilingual, but we also have an interpretation line that we utilize at all of our Parkland Health sites that has multiple languages, if it's a language that one of our staff can't speak.
What kind of reactions do you get from the families that you're serving on a daily basis?
Oh, they're just happy that we're there and be able to provide care for their children.
Has this switch been better for your employees as well?
I think that was part of it too. I mean, driving to multiple sites during the week is a lot on staff. And so one of the things that we looked at was also staff satisfaction. So, not just what was best for the community, but also the staff and, increasing the productivity and the access for the children.
When you consolidate from 11 down to 4, is there a possibility that things might get a little crowded as far as appointments?
There could be. We haven't seen it yet. So we open on Monday, July 11th. We haven't seen it yet, but if it were to come to that, then we would reassess and see if we needed to add more sites or more providers.
When we talk about sites, are these buildings that were other use and are now being occupied by Parkland, or these were already properties from Parkland that people were familiar with?
This is actually a collaboration with DISD. So this is their property and on their campus. So it's really removing the barriers to care for the children and the families by providing this service and this clinic on school property.
So you made the choice to go down to these 4 separate areas, and are they in really wide variety of places around the area as well?
Yeah, they're spread out through Dallas County. So again, these are areas of need. Like when we looked at Parkland's community health needs assessment, these are areas that were identified as need.
And for our listeners, can you give us the rundown of the new locations?
Sure. So the clinics that will be open 5 days a week include Adamson Youth and Family, Balk Springs Youth and Family, Fair Oaks Youth and Family, and Seagoville Youth and Family.
There's also other clinics that are going to be able to help as well for those that are closing.
Sure. So we have one of our clinics, Redbird Health Center, that opened in September of last year. And so we had a youth and family that was pretty close to it. And so we are closing the youth and family Redbird, and those patients will transfer to our Redbird Health Center, which has a full pediatric office. And so that's just one example of one of the clinics that's closing, but the patients will be transferring to one of our community health centers.
As school gears up, will you guys have any partnerships in town with trying to get families to, of course, get their vaccines, possibly even COVID shots to the area?
Yes, we have already started working on that. We always have walk-in Wednesdays. So on Wednesdays, we do back to school vaccinations, not just at our youth and family, but also at our health centers. And then we will also be doing some outreach events specifically within the community just for back to school.
What is it like for the kids having to go into these clinics? Do they deal with some anxieties? Is it also an anxious time for parents as well?
I think that it depends on the parent and depends on the student, but I will say that there are definitely kids who don't like shots, don't like any vaccines. And so no matter what, there might be some anxiety for back to school. And then there are some kids that just watch you put the needle in their arm and they're completely fine with it. And they'll probably be our future nurses and doctors.
And we've been talking a lot specifically about school age kids, but do you take toddlers and babies as well?
So we start at age 4. And so, yeah, definitely before school starts.
All righty. Christina Mintner, thank you so much for your time today. We appreciate it.
Thank you. Thanks for having me.
Absolutely. We will end the recording right there. And sounds good to me. Was there anything else you felt like our listeners needed to know?
I feel like I should have said that, I mean, and this is me because Chelsea will tell you this, but I feel like I should have said that we needed, that kids need regular access to healthcare to reach their full potential as adults.
Would you like to add that at the end of this? We can start the recording again.
You think I could add like the quote that I have in the press release or?
Sure. Let me go ahead and start. Here we go. All righty. In 3, 2, 1. And Christina, as our families are spreading the news about these new clinics, what else would you like them to keep in mind?
Well, just a reminder that regular care is essential to a child's physical and emotional health, growth, and development. And we want every child to reach their full potential as adults, and that includes regular health care.